Good evening. This is the Town of Littleton Board of Health meeting for Wednesday, September 28th. We'll get things started with our 7 o'clock public hearing, potential motion to adopt a local regulation, all SDS within 100 feet of a bank or bordering vegetated wetland. Let me just read this whole bordering vegetated wetland defined by 310 CMR 10.54 and 10.55 shall treat domestic wastewater to secondary treatment standards as described in section 310 CMR 15.202 of Title V. I know we've spoken a lot about this. It's probably been, I don't know, 2 or 3 months now. We sort of put things on hold so we could give the public notice and get into a discussion about it tonight after it being posted. I guess, Jim, do you want to kick us off before we open it up to anybody that has any comments?
Sure. So you and I had an exchange back in August about the proposed requirements, and I had kind of mentioned that I think I understand what's trying to be accomplished, but one of the reasons why the general law for making regulations for boards of health have this requirement for public notification 2 weeks out and then a week out is that in the late 80s, boards of health were using their board of health regulations as de facto zoning. Right. And so that's why they have that requirement in there for the hearing and then for defending the local conditions under which you believe that you need, that are unique, that you need to make this reg. Mm-hmm. And so we've had some challenging lots in town. And certainly some, we kind of gone round and round on where I think, based on multiple conditions, wetlands, high water table, that type of treatment that you're describing would be appropriate. I guess what I'm trying to look at is, at 100 feet, you'd probably potentially see many variances because the treatment components aren't cheap. I think that treatment tanks are probably $7,000 to $10,000, which is significantly more than a straight septic tank. And if the town residents otherwise meet Title V, and most of the town is town water, and somebody wanted to challenge it in court, it may make it a difficult situation to defend. Again, this is what they want you to be able to do: defend what the unique conditions are in your community that require that. So, and kind of our back and forth, my suggestion would be is to, maybe tie it to the offset reduction request. Often, because a lot of the innovative alternative technologies allow your boards of health in Massachusetts to reduce that offset up to 2 feet. A lot of times people come in with it reduced up to 2 feet without remembering kind of the first part of Title V, which full compliance is what they would prefer. Mm-hmm. And then just like the local upgrade approval process allows boards to modify things based on lots and conditions, that up to 2 foot reduction that you can grant is in that same category, in my opinion. So again, that's my thought, maybe tailoring the use of these devices to a lot that has multiple variance requests. Offsets to property lines, offsets to wells, offsets to wetlands, and looking for the groundwater reduction. If you're looking at it from the public health standpoint, why is it that we'd want to use one of these components? Well, because we're granting a whole bunch of these offsets. We want to try to put in some kind of mitigation factor to say we're protecting the public health anyway because we've done this in conjunction with those offset reductions. So that's kind of how I've looked at when people are looking for variances and local upgrade approvals from the board. That's kind of the lens I look at it. So what are you asking for? Why is it important that Title V is regulating it? And what is it that you're trying to do to mitigate it so that the board can actually grant it? And with the upgrade, most upgrades, hall upgrades, are better than the system that's in the ground already. Right. So I mean, in that case, my thought is if they're asking for lots and lots of little things, adding treatment on a miserably tight lot, that makes sense to me, because I know it's an expense, but also we're the board's allowing a system to go back there with lots and lots of variances.
So maybe it's tied into the groundwater offset reduction request, stating something like let's see. If a groundwater reduction request is being sought, then the sewage disposal system is within 100 feet of the bank or vegetated wetlands, then you would be required to have treatment.
And to me, because you're reducing that groundwater offsite, that's the part that, from a public health standpoint,
right. If everything were 4 feet, we wouldn't have a problem, right?
Right. And I could, to me, that's a defensible thing. It's like you're asking for half the offset reduction. We'd like you to clean up the wastewater as part of that variance request.
I think that's reasonable. I think it makes a lot of sense. I think it's defendable. I just don't want to see us in a situation like we saw in Maplehurst where we knew it was the right thing to do to put in treatment, but we had no leg to stand on because there was, nothing, all we had is like good faith and this is the right thing to do.
I mean, the ultimate decision to do that is yours as a board. And again, you're trying to weigh lots of different things. Again, the system that went on that site
way
better than what was there. And I think sometimes in the public's mind, the thought of new construction versus upgrades blurs a little bit when they see an old house come down, a new one go up. They don't realize the nuance that as long as they change the number of bedrooms in that house, the state still views it as an upgrade.
As a repair,
Yeah, so it's not that's any public health issue. It's just a public perception issue sometimes.
Understood. Well, I think I'm at a better place now after having this, 5-minute conversation with you just regarding the groundwater offsets. And, if people are coming in seeking that, and there's, I don't think we want to say, if you come asking for more than 4 variances,
right.
Then, that's, you can't say that because who knows what the variances are. They might be for a sieve,
Right. But maybe the groundwater offset reduction in conjunction with other variances, i.e. the offset to wetlands, or that way there, again, the more that they're looking to vary, the more reason it is that you want to be protective in other ways with some kind of mitigation.
Well, I think in particular, we're going to see a lot of these geomat systems, which, they can get the 2 foot. And I think that's kind of where it's coming from, is like, we don't want to be at that 2 foot in a sensitive area without treatment.
Right. And to me, the geomat's a fairly new system to us. I think we're going to have probably 8 or 9 of them now in town, but the oldest one is probably just a couple years old. Mm-hmm. And I haven't heard any issues with them yet.
Great.
So the cleaner you can get that wastewater to put in that geomat, then it really is just like a sponge putting water back into the sand underneath of it, and hopefully it lasts a good long time.
Right.
One of the benefits of the geomat is, if you drive up the streets in the lake area, you can kind of see the evolution of Title V and innovative systems by the reduction of retaining walls in certain areas. We don't have to build, we're not building systems up. You have more tools to help keep systems closer to the ground, reducing runoff to other lots, reducing retaining walls. They fit better. But if it gets tight, the ability to say to somebody, hey, we'd like you to treat it so that it adds to the longevity of your system, I think that's a reasonable thing to do.
Okay. I just want to do a round with the board members here just to see if there's any questions or comments, and then we'll open it up for public input. I guess we could start with alphabetical order. Kevin Davis.
Thank you, Jim, for all your comments. They're great. They're very thought-provoking. I've taken a little more time than myself to think about it, and I really like the approach, and I think it's a good thing to have. It gives us a little more strength to enforce Title V in challenging areas. That's all I got.
Thank you. Gino Fratelloni.
I concur with Jimmy, and I understand that we have to follow, the idea that the Commonwealth of Massachusetts do have some yes and some no, but he explained it to a point where we understand what he means. Thank you so much, Jimmy.
Thanks, Gino. Dan Kane.
I think really it's looking at how we enforce our existing regulation and options, that a variance request is not a rubber stamp, which I think it often is looked at that way, that we've had a lot of these tools available. We just need to be able to document why we choose not to grant a variance in this situation when we have in other situations that look similar, but in practice really aren't. And certainly that's a little bit easier case by case to support necessarily than the regulation, which is kind of a flat always, as opposed to enforcing existing regulation. So no, I think this is great. I think Jim clarified it really well and reminded us of our authority and responsibility as a board, that it's not a rubber stamp. Otherwise there'd be no variance process. There would be no regulation. People would just do whatever they thought was best, or whatever an engineer thought was best, or whatever was cheapest, rather than trying to find that balance between public health and cost, everything else.
Yeah, right. Thank you. Matt Wason.
Thank you, Jim, for your comments. I agree. I think part of where I struggle is I also have been thinking ahead about, like, well, after this one is kind of done and in the books, what's the next thing? And is it that like 6 variance requests that you get, and how can we address that? So I agree. If there's a way we can combine them into one, that would be helpful. The offset's probably a great choice. Are we going to run into a situation where they've got the offset, but they got 5 other variances? And once again, we're back in the, oh, well, you got the offset, so technically the regulation we have doesn't apply to you anymore. I think it's unlikely, because that always seems to be present, the offset variance request. But will we find ourselves in a situation where they're on the property line and on the foundation and too close to everything else? And will this still cover us? But I like it. If tying it to that does make it a little more firm and understandable. I agree. We could go forward with that. I also don't want to forget that it used to be 100 feet, and it was changed to 50 feet. And in all honesty, it used to be you couldn't do it in 100 feet. And we're saying you can do it in 100 feet with a treatment system. So frankly, we are being more progressive now than the old regulation that predates the current, at least. So I feel good about that, because at least we're trying to move kind of towards the future. And even within 50, you could start to say, oh, well, we're just going to say no to that. And a piece of me, we have the precedence comment, but we're a board that changes periodically. And who's to say that the next person who joins the board, or even Kevin Davis, as he falls off the screen, starts saying, no, I am personally never going to vote in favor of that variance. And I don't know how that looks, in the courts and legally, but there's nothing that says I have to follow the precedents that this board has been doing if I feel the right thing for the health of the community is X. But I just throw that out there just as a thought. I don't think it really affects the way I'm thinking or the way we're going, but just food for thought.
Thank you.
And Kevin, if I just might, to Dan's point about documenting why it is that you grant a variance, I think that's kind of addresses Matt's point too. If you're specific about we granted the variance here because, and list the conditions, then and unfortunately, I don't know boards that get really challenged a whole lot in court with these regs, so that's a good thing. But if you were to be challenged, you'd like to be able, I think, although some court precedents are changing a little bit, but I think the court probably looks at the Board of Health as the person who's protecting public health and probably gives your opinion and decisions a little bit more weight. You'd like to be able to help them feel more comfortable that you are doing that. And so to the extent that you can document why, I think that helps.
So at this point, we will check the audience and see if there are any hands raised. Just take a quick look. I don't see any. Oh, Margot Bloomstein has her hand. So let me promote you. Dave, can I promote?
Texas, I just got back on my.
No, only I can promote. Do you want me to?
Yes, please. Margot Bloomstein. She's got her hand raised.
Okay. She should be on the way.
Thank you. Hi, Margot. Could you please state your name and your address?
Hi there, Margot Bloomstein. I live at 7 Wilson Lane, and I guess I want to make sure, is now the time for public comment on other Board of Health topics, or do you want it just on this?
Just on this right now, and then we'll wrap it up and move on to the next one, and then we'll take public comment after in each section.
Okay, sorry, I'll remute myself then. Thanks.
Okay, thanks. So at this point, if anyone on the board is interested in revising some language to sort of be more in line with the conversation we have with Jim in regards to when a groundwater offset reduction is requested, and I can spill out some language if you want, but if a groundwater offset reduction is requested, and the SDS is in 100 feet of the wetlands defined by shall treat domestic wastewater to secondary treatment standards, something to that effect. If that all sounds good, I can run it off and make a motion, or if one of you guys would like to do that, it's up to you. Matt Wason.
So to clarify, this would be, if it were phrased that way, adopting a new local regulation, because the 50-foot one will still remain.
Well, the 50-foot no touch
Correct.
is in effect, and in regards to Title V says 50 feet, so that regulation will always be there, right, Jim? That's
Right.
it.
So you'd be adding a new regulation to yours that now makes that requirement 100 feet unless they use treatment. If I understand the motion as the reg change as it is.
And also if there's a variance for asking for a groundwater offset. If you're asking for a variance of groundwater offset and you're within 100 feet of blah, 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 blah.
Yes.
So that won't affect new construction because they can't ask for that reduction. That regulation will essentially function to apply to upgrades. I don't know if I made that clear or not, because with new construction, they always have to meet either the 4 or 5 foot groundwater offset, depending on the type of soil. It's only when somebody's doing an upgrade, keeping the same house, same number of bedrooms, can they ask for that up to 2 foot reduction in the groundwater offset.
So that would imply that for new construction, the 100 feet would be totally moot. They would only have to.
Yeah, I think if you added that second piece about the groundwater offset.
Because they wouldn't be requesting a variance for
Right.
groundwater offset, right?
But again, in the case of new construction, they're going to meet the 4 or 5 foot groundwater offset. So, and Title V mentions that the regulations are considered protective of the public health and safety. So that's why in the general law that allows you to make regulations, they want you to explain the local conditions under which you think it's unique or needing some additional reduction, some additional regulations above and beyond Title V.
Groundwater. It's how we drink. It's where we get all our water from.
Sure.
So I can make a motion just in the essence of time. Let me see how we want to phrase this. If a reduction to groundwater is requested, if a reduction in the groundwater offset is requested, the sewage disposal system is within 100 feet of a bank or bordering vegetated wetlands defined by 310 CMR 10.54 and 10.55 shall treat domestic wastewater to secondary treatment standards as described in section 310 CMR 15.202 of Title V.
A second.
All right, motion and a second. We'll take a roll call vote. Kevin Davis,
And Davis votes yes.
Gino Fratelloni,
Yes.
Dan Kane,
Dan Kane, yes.
and Matt Wason,
Now, Wason, yes.
and Kevin Baker votes yes.
So kind of finish the process, probably get it typed up, and send it off to the DEP Central Register. Probably get it stamped by Diane first and then send it off to the Central Register. So and then it needs to be published in the paper, and then it can become into effect.
Okay. Got it. Thanks for your help with that, Jim.
Yep, not a problem.
So moving on, we have a 7:10 public hearing regarding our ID decision support tool. Matt Wason, I didn't know if you had anything prepared. All right.
All right, here we are for this week. No change in the variants that we're looking at. It's the BA5 that's most predominant. 4.6 is in second place, and far behind is 4. And our good friend 2.12.1 is looking like it's getting a little bit of bump back up in popularity. Our 2-week case counts chart on the right are definitely jumping up over the last couple weeks. And similarly with that, our CDC community level, which took a brief dip down to the low green level, has come back up to the medium, and that's driven by the case rates. So we're just seeing more cases. Tied to that are the wastewater numbers. Those have eclipsed 1,000 for both the sites out of Boston, and they're at numbers that we haven't seen since actually early January. So that's our big red flag right now, because that's our prognostic factor, and seeing those numbers start to move up a lot, I think raises concern for our community on the dashboard side. I think it's hard because I think the messages people are hearing from everywhere they listen are that the pandemic is either over or it's not a big deal anymore. But I think it's not surprising to see that school has started and numbers are going back up.
So wastewater levels we saw those in January?
Yeah, we haven't seen numbers that high, at least on I think the south site, with that 1790 since the beginning of January.
We'll do a round. Kevin Davis, any comments?
Yeah, so the wastewater numbers are starting to, have that trajectory that's not looking really good. So we need to start paying attention to that. That usually means it's usually a 2-week prognosticator from what we saw before, things happening. So that's always there. Has the school system, have we reached out to the school nurses and started to work with the superintendent or somebody about absenteeism and things like that?
So I had a conversation with the chair of the school committee, and we were talking about the absentee data, and I don't think those numbers are really going to tell us a story that's true. I think there are too many variables and too many other factors that go into that number. I do think that the school committee is looking to the Board of Health for some guidance and some advice. And if there were some news that I think we just maybe came across during our discussion in regards to this wastewater and the levels being what they are, and levels that we haven't seen since January of this year, that's a big red flag that I think the school committee would like us to share with them.
So we heard
in maybe a letter stating that you may expect some staffing shortages. You may want to take extra precautions. That type of thing.
So here's my fun thing on that. That was said by the Dr. Clenchy. He said, I don't think the numbers are going to mean much, blah, 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 blah. And unfortunately, I disagree with that. We're looking for trends and trend numbers. So just because, there may be one opinion that's not going to matter, we should start looking at them and start to see if there's a correlative value with the data, and not just put our heads in the sand and say there's nothing really there because we don't want to have to provide it. It's an absentee number. Give us the absentee number and we can start tracking that per week. They know what the absentee number is from the start of school. We can start to track that like the first week, second week, third week, see what it is. And we can start to see what that is. I mean, the over under on people taking family trips or, whatever the reason is that somebody's out is going to get washed out in the numbers. If we start to see a large absenteeism go up and it starts to correlate to a rise in the numbers that are reported, then that's something to start to think about. That's something that we can start to look at and say, hey, let's start looking at the data, because when they had the COVID numbers in the schools and when they were actually doing the testing and the pooled testing and the surveillance testing and things like that, it was a really good indicator of where the health was with regard to COVID-19. And now that we don't have that data, we're essentially flying somewhat blind because, as everybody knows, home testing, you don't have to report things and things like that. Although the latest apps that are there for the iHealth one and things like that, if you want to, at the end, you can actually report those numbers to the CDC. So that might be something that we start to encourage people to do. In fact, all of the ones, the ones that I have quickly at my reach, the Binex Now test from Abbott and the iHealth one here, both apps at the end of a positive or negative actually say, do you want to submit the data to the CDC? So this might be something that if people are doing that and they want to share that data, they should certainly share that data with the CDC, because that'll help us chart to get some of those numbers back into the equation. So there's that. So I'm not in favor of just letting it go, because then, okay, if they don't want to give us absentee rates, then what number do they want to give us, right? Because it's not that hard. They know and I think I'll go offline here in a second, but I want to go research something real quick. But yeah, that's my opinion on that.
Yeah, I mean, I feel like if we put together a formal letter requesting that, we get a report from the school nurses or, central office regarding absentee data throughout the buildings, I think putting that letter together and requesting that and have them take it up at one of their meetings and see what they want to do. I think it's probably a pretty simple thing that can make everybody feel a lot better if we can get that accomplished. So thanks for that input, Kev.
Yeah, I kind of want to second what Kevin said.
Okay.
I would never intend to use a data point like that as a sole driver of action.
Yeah.
Never.
No,
Never.
the wastewater
It is
should
not
be
an on-off switch. It's more of a signal that drives you to ask questions. And frankly, if it stays really low all the time, we can all sit back and feel pretty comfortable that things are probably in pretty good shape. When it spikes, it's just a moment to say, hold on, it's spiking. Can we do a little investigation so we can figure out if we should be taking any action or not? Just to use it as a signal, because like Kevin says, I'm worried that with no signals, then a problem could be happening that we don't find out about until it's, kind of too late to be taking really proper action. So I think something like that is worth monitoring just for that reason.
Dan Kane?
Yeah, I certainly, as we've talked about how do we use some of these tools to better communicate across, and same way we talked about with the new public health department, of how do we really combine both our quantitative intelligence across all of our agencies, the school department, the police, the fire department, that the schools, as we've talked about, are a bit of a canary for us, that we have a large percentage of our population in a few buildings every day during the school year. So that while I completely agree that those absentee numbers are have a huge set of variables that are going to affect that. But I think in some ways we're kind of stuck in the COVID mindset because it's what we've been dealing with for so long. But certainly it's those COVID numbers in conjunction with information from the school nurses can really give us information pretty quickly about the health of our community in general. So never mind COVID, we've got a little bit of a bump. Okay, even if our absentee numbers don't climb high, but our school nurse is saying, wow, we've had 28 kids out of school today or this week saying with flu diagnosis. So even those absentee numbers are relatively flat, the school nurse saying, wow, we've got a flu outbreak going in town right now. Not saying we do, but that kind of information is really, really valuable because it's one of the few places we can actually get that near real-time data about the health of our community, or norovirus, or pretty much anything, because either it's happening out in the community and it's coming up in the schools and it's being identified, or it's being shared in the schools and it's being going out into the community from there. And it's going to be something that we're going to need to be thinking about, concerned about, or perhaps need to intervene. So I completely agree with the variables can be all over the place. And, certainly between this time of year with college visits and those kind of things, but the office knows, okay, I've got this many excused absences for this, I've got this many excused absences for that. They tend to get a sense pretty quickly about where that is. Sharing information back that, certainly this tool is a work in progress, but it can be predictive in some ways. If we're seeing wastewater numbers, obviously Boston and Worcester are not our numbers, but it does tell us a little bit about our community in our region in general, that, we might be looking at a bump. We're looking at our statewide numbers. Hospitalizations are relatively flat since July, but we're looking at 200 primary cases in the hospital, since July. So it's still happening out there. It's 45 deaths last week, with the primary COVID cause of death. So while we're all kind of getting back to normal, back to it's over, in many ways it still is out there and folks are still getting sick, and there are a few folks who are still having bad outcomes. So again, we need to really, we tend to silo pretty easily here, and it's really, really hard to get past that. We want to support the school department and our students the best we can, and we want their knowledge, experience, and public health intelligence that they can provide back to us, so that we can make good decisions, we can be proactive, we can identify things early, so we're not hearing it from Mavis 2 weeks from now when someone has gone to their primary and we've got 100 people going to their primaries who now they report to Mavis, and now it's showing up on Jim's desk and we're a week in or we're 2 weeks in before we're identifying a potential outbreak or something, where the school probably was aware of it on day 2. We know our school nurses, they're rock stars. They pretty much know within a day or two, because they're going to call each other and say, hey, I've got 10 kids with these symptoms. Hey, I've got 5 here at the middle school. I've got 7 at Russell Street. And they know within hours that we got something going on. Mm-hmm. And are really starting that root cause analysis, starting that, the epidemiological piece before our public health nurses have ever even heard of a case. They're already starting to figure out what's going on so that they can try to nip it in the bud. Yeah, and that's kind of resources that we can't provide, we don't have, because we're not in the schools. We're not seeing 1,500 kids every day. Mm-hmm. We just don't have that sample size in real time. So I obviously want to do whatever we can to support the schools and our students and the school committee and their function, and if they can share some information back, that real-time stuff for COVID, for GI, for flu, for who knows what, whether it's food poisoning coming out of a restaurant, find them early. That's what we're going to do for it. So let's break down some of these silos and let's work together, because we're all in this for the same thing.
Thank you. Gino, any comments?
A very short one. The question is, the school should let us know if somebody gets sick. If they, like you say, 1 or 2, and they can send the kids home or have them tested. If they don't feel well, they should stay home.
Yeah, the school's doing a great job.
I know they're doing a great job. I concur. Yes, I understand. But the question is, this particular COVID-19, how long is it going to last? The question, people don't know. I have people they already went through the vaccine and everything, and after a while, a month after that, they got COVID-19. They had to stay home. They couldn't go anywhere. So this what you have to do, make sure that they stay home if they find out they're sick. And the school will do, I'm sure they will do the best they can when they notice there's going to be so many more 20, 29, 28. Even if there's only 10, let us know. And send those kids home, for if they're not feeling well. But they should be tested. That's my my comment.
Thank you. Jim, do you have any comments? Questions?
So there are, I mean, the state, both the state, DESE and Department of Public Health, kind of updated their guidances that they provide to schools. Now, did your board have a meeting with the school committee earlier in the summer?
We did, and that's an excellent segue because I feel like we're just about at that portion of our meeting to get into that public hearing piece of it. So we'll open that 7:20 right now as we move forward.
So they have the memorandum in August 15th, Department of Public Health and DESE. It looks like they provided some updates to the school. There's a school nurse or school health manual that the Department of Public Health puts together that school nurses operate under. And then back in May, kind of unceremoniously, they, and again, modified it in the 15th of August to kind of codify for this year, changed school camp and essentially childcare, isolation and quarantine guidances. So it's still a bit of a challenge. And in that, again, the document from the dual departments, it kind of outlined that they weren't looking to do contact tracing. They weren't recommending universal masking. So there's a whole bunch of things, or surveillance testing. As far as testing, asymptomatic people shouldn't be excluded from school. They were talking about the contact tracing. Just trying to go through some of the other kind of. So the reason I bring this up is we've had conversations with school nurses at the beginning of the year, and they've not in Littleton, but at least in one of the districts, there was a classroom, I think within the first week, a classroom of 20 where 12 kids had COVID, and the school teacher. And with the school nurse reached out to our public health nurse, and they kind of figured out that the big driver of that might have been a birthday party the weekend before. And so, I mean, you kind of get a sense of what's happening by that contact. And in Massachusetts, school nurses are supposed to report to the Board of Health communicable diseases. One of the things they changed in some of this documentation is the reporting to DESE, I think, and DPH is that only tests that the school does and test positive. I think now they're required to report. So the reporting requirements are a little different. So things have changed, and I just wasn't sure if that was kind of the conversation you were having with the school committee, or how they're incorporating those changes.
Yeah, our meeting with the school committee was more based on the crisis response guide that we were putting together in regards to the different levels of concern of any sort of disease or public health threat. And, while we're, at stage 1, we're monitoring, and then, stage 2 gets more severe, and 3 and 4 and so on. And just sort of going over that, asking for their input and their feedback on that. We did, I think it was a very productive meeting, and we came out of it with a sense that, the school committee, is willing to work with us, and, would they see us, I think, as more of a, they want to know, they want some guidance when we see things ticking up. And I think that's totally fair for us to, communicate with them after this meeting, after we've just gone over our ID decision tool, that, we are seeing wastewater, COVID in the wastewater at levels not seen since January. We would, kindly request daily absentee data submitted by the school nurses to the Board of Health so we can continue to monitor the situation. And we do have, I think 5,000 or 5,500 more tests coming. Then I think the school is probably going to be the biggest utilizer of those. So as long as we can, continue to work together and not feel like we're on 2 different teams, because we're very much on the same team.
Right.
I think we can have a successful partnership and keep things keep things going in the right direction.
So Jim, did I hear you correctly? That you said that school nurses are supposed to report communicable diseases to the Board of Health?
So they're reportable diseases. So they're saying clusters. They're reporting it to the Board of Health. And this documentation here actually mentions that if somebody tests positive, they're supposed to report to the Board of Health.
Oh.
And again, I think the Maven reporting, since they're reporting to the state, that's probably how the state's having them satisfy that requirement.
Yeah, but okay. I hear you, but I think it might be a little bit better.
So reporting to Maven satisfies the requirements to report.
Well, I'd have to take a look. But like I said, so there's 3 documents. The one that's the additional information says notifying local boards of health. This is a section within their motto. School nurses must notify local boards of health of every positive COVID test performed in the school, both students and staff. Reporting results to the Department of Public Health using the electronic method satisfies this requirement. So that's why I'm interpreting Maven as, as long as it's being reported through that, that's satisfying the requirement.
Okay.
So they will have to have those numbers because that'll be something that they want to make sure that the data is reported up and out to Maven.
So, and again, I can send these documents to you. I mean, I wasn't sure if this is what the kind of because they would have been out by the time you met with them. There's it used to be that they reported reported all the tests that they did or that came into now it's just the tests that are done in the school that get reported, and it's a different system that they use than I guess they were using before. So,
but I think that's a key question: is are they doing any testing in the school?
So I think their focus really is on symptomatic testing.
Right. So I think there's 2 things that we're asking for. We're asking for the weekly absentee rate, right? Because we don't need it daily. If we had a weekly number that ties to because we only get a weekly number for the COVID stuff. And if we got it on whatever day they do their stuff, because I also thumbed through some of the DESE stuff, and I'm not a DESE expert, but it looks like they have to report either on a monthly or a quarterly basis absentee rates and dropout rates, and there's a whole bunch of other rates that they have to report up and out. So I'm not the expert on that. But if that's the data that they have to collect this data anyway, so all we're doing is asking for us to be included on that data.
Yeah, I think that's totally reasonable. I don't think they're gonna have a problem with that. Yeah,
and then the COVID numbers. So that would be interesting if they're required to report the COVID numbers anyway to that. We might want to find out from Jim if you can do a little sleuthing to find out where those numbers are going electronically. That might be something that we can ask you instead of asking the nurses for, to try to see what's going on there. Because if the data is already there and they're reporting it, we can do a query that way, right?
Yeah, there's something in this document that talks about must be reported to DPH using something called simple report. So I don't know what that is. If it's I just need to find out what that is.
So that would help. That would certainly help, because if they're already reporting those COVID numbers of the symptomatic tests that they run, now do they have to report a negative, or it sounds like they only have to report a positive?
Only positive.
Right. So that would be something interesting also to kind of understand, is how many times did they use a test, right? Because that'll also give you a trend. Because if they go through 1,000 tests and 4 come back positive, that tells you something.
Yeah, Jim, if you could send us those docs, I'd like to include some of that language in a letter to the school committee so they can take it up at their next meeting and take a vote.
Before our school committee meeting, a lot of those are what I sent out to the group. So you might have them already, because I sent out the DC link and the CDC link and our local Littleton Public School, I think.
Okay.
So check that. But yes, Kevin, it is really key, because I would love to, let's look at that data. Let's see what it looks like. But it wouldn't surprise me if the denominator is minuscule.
Oh yeah.
And I also don't really necessarily trust the kid comes into the nurse's office with symptoms, gets tested, test is negative, so we go, it's not COVID, because I've just been seen so much of the first test is negative and 2 days later it's positive, and then we're losing it. So would love to see the data, but wouldn't hang my hat on that one for very long.
Yeah, and that's kind of it's kind of a look-see. I want to, it wouldn't hurt to see if that has a trend also. You know what I mean? It's kind of like we're doing this because we're trying to figure out what might trend and correlate appropriately.
Yeah, when you can see all the data together, you might be able to figure out a piece of the puzzle that
Right.
is otherwise undetectable. So
Right.
Yep. At this point, I'd like to invite Ms. Bloomstein. I know she had her hand raised for public comment before. I think we did receive some correspondence this week, and I think this is the subject matter, which is very fitting for probably what you're going to correspond to us now.
Yeah, thank you. That is, I feel like the best possible context in which I could have joined. So thank you. I really appreciate hearing like Matt and Dan and Kevin, you were all kind of saying things like around the value of why we need to be tracking this data. And I guess the flip side that I see to that is communicating the data then to empower people to make good decisions. And I know that obviously you want to track data in aggregate and collect enough so as to change policy. I think that because that takes time and should take time, I'd like to see some changes maybe in the interim that you could probably start immediately in the school. So specifically, and I know I wrote a long email, so no worries if you didn't read it. But when I emailed a few days ago, it was after COVID had hit our house, after we'd gone 2.5 blissful years, as blissful as a pandemic can be, I guess, 10 days into the school year, my kid brought it home from Shaker Lane, and she's, I'd say, militant about masking. Sometimes is even like, "Mommy, why don't you have on a mask?" So, which I appreciate. We're working on that tone, but she's militant about masking, except for in the cafeteria and during snack time. So we're like, okay, we think we know where this came from. So she brought it home, and to what you had just said around some of those negative tests not really being so negative, my husband and I tested negative. We went and got PCRs the next day. We were negative on the PCR. He started showing symptoms. He tested positive on a PCR then the next day. So it definitely came home to roost. And the reason I emailed, though, is because what I saw is that the school communication isn't in line with DESE and Department of Public Health guidance right now. And I think that it is actually undermining public health as well as parents' ability to make good decisions on behalf of our kids. And specifically what I was reacting to is that the public health guidelines, as I'm understanding them from the website, say that after an exposure, kids should mask for 10 days and then test around day 6. But if we want kids to mask after an exposure, we need to tell them and their parents that they've been exposed. And I know right now it says there's not going to be contact tracing. I don't think we need to do formal contact tracing for that. What I was hoping would happen when we notified the school nurse and notified her teacher was that, there would be like the klaxon going off and the email going out to just at least the parents in her classroom. She's a first grader, so everybody in there was exposed because first grade. I wanted that email to go out just to say to parents, hey, there's been an exposure. We can preserve anonymity. We don't need to say who it was, but your kid was probably exposed. Reminder, the guidelines are mask for 10 days, test on day 6. Right now, in Shaker Lane, at least in the weekly email that we see from the principal, there's some stuff buried at the end that's just kind of reminding us on general COVID guidance around wash your hands, take tests at home. You should probably mask if you've been exposed. But we're not connecting those dots to say, there's been an exposure in your classroom. Smack a mask on your kid if you don't already. And so as a result, I texted and emailed the parents of the kids that she sits closest to say, you might want to test your kid. Mine just tested positive. So it was kind of like we were trading that anonymity and privacy for public health, which I'm totally fine with, but I can understand that some parents might not want to. But I felt the informational value that the school was kind of abdicating. Okay, individual parents have to take that on then. And I'd like to see our schools get in line with that policy with just a small shift in that communication, because I think that could help prevent other small outbreaks, help us get ahead of that. I mean, in my email, I mentioned that in another school with a population of about 300 kids, they saw 11 cases in like the first, I think, couple of weeks of school. So they said, all right, now any classroom with more than 2 cases, the kids will mask for 2 weeks. Kind of brought things in line. I don't know if that's right for us, but I think that at the very least, that kind of communication would both bring us more in line with both the letter and the spirit of that policy at the state level, and it would empower parents to make better decisions.
Thank you very much. It was a well-written email too.
Thank you.
Board member comments, Kevin Davis.
Final agreement. I think that's the kind of communication that should be coming out of the classrooms. I think that if someone in a classroom is exposed, you can say, hey, we had a COVID case. You can, it is, per DESI guidelines. I don't even know if it's DESI guidelines. I'd have to go look at that. But, hey, consider increasing your vigilance. Wear a mask so that way if your child comes down with you, you're not spreading it as much, yada, yada, yada. All those kinds of good things. I think that would be an easy communication. My question would be, how often is that email going to be going out? Because that could potentially be quite a large number. However, the school I know has a way or should have a way of saying, hey, these are all the kids in this classroom. Here's our standard email, just go send it out, because they all have that data and it's all in a database somewhere. So they should be able to do that. I know at my place of work, they are, if we're in a lab situation where we have a closed lab, they are the nurses that are there are informing the closed lab spaces for that. So that's something that's still going on in my place of business. So.
Thank you.
I like it.
Janelle Fredoloni.
I think we should say thank you to the young lady. I think I concur with her, and if everybody feel there is a problem, like she says, wash your hand, put a mask on, 10 days, check 6 days. I think she has a good idea. If we can just make sure that we can prevent any escalating in the school, it'd be nice. So maybe we should send a note, exactly like she says. I mean, she's a parent and she's concerned about the children, not only her children, but the children of our school. So that was very nice of her to come in and specify the needs that we need to have and concur.
Yeah, I agree. I think, I think this virus has been evolving, for the past 2 years, and how we handle it and how we deal with it has been evolving, and the rules are changing and the guidance is always changing. And sometimes we just need to figure out what is going to be the best for our community and our residents.
Right.
And I feel that if we were able to verbalize that and put that into a communication with the school committee, they would take that to heart. And, hopefully we can see some positive response and put a plan in place to make sure that we have our, Littleton exposure notification system.
Right.
And, I know we're not doing contact tracing, but we have the data, and we can keep it anonymous and still let all the folks know that might be affected. I think that's, that's probably the best we can do.
I'm sure the school committee is going to do the best to emphasize and also to follow suit.
Dan Kane, any comments?
Obviously, as with every board, we want to make sure that ourselves and our staff are in compliance with all applicable guidelines, and it certainly seems like an email out to potential exposures is a relatively low effort intervention to minimize further exposures to others. Wearing a mask, we all know that nobody wants to wear a mask. We all get it, but it's, again, a relatively small personal impact to keep everybody in school and hopefully keep those folks who, even with immunizations, are not fully protected as safe as possible. We want to
Yeah.
keep every kid in school that we can.
Keep the
A
parents
mask for a
working
couple
and-
weeks is an easy one,
Yeah.
if that's going to minimize 1 or 2 more cases in that classroom, or a teacher going out, which obviously is going to have a much bigger impact on a classroom than, as unfortunate as having 1 or 2 students homesick. We take a teacher out of the classroom for 2 weeks. That's obviously a much more significant impact on our students every day. I would ask the chair. I apologize to Ms. Bloomstein. I have not seen your email. I'm not sure if it was shared out with the board. Am I the only one who did not see it?
No,
Looks
no,
like, yeah, it was not actually shared with the board. So it sounds like Kevin saw it, but
saw
I
it.
apologize. I did not see it. I would have loved to have read it. And even if it's long, I still love reading emails. So hopefully Kevin and our admin will be able to share that with us so we can
Yeah,
actually
Brenda
see
should
it.
have sent that out to everybody. I'll forward it now.
Thank you.
Matt Waston, any questions, comments? I know you stepped away from.
Yes, I do. CDC guidance on K through 12 school system state people who have known or suspected exposure to COVID-19 should wear a well-fitting mask or respirator around others for 10 days from their last exposure, regardless of vaccination status or history of prior infection. The state of Massachusetts isolation and exposure guidance protocols for K through 12 educational institutions says that exposed individuals may continue to attend programming as long as they remain asymptomatic. Those who can mask should do so until day 10. And testing is recommended around day 6. DC guidelines, they don't say anything. They don't say anything about masking, except there are no requirements for masking. And then if you look at the Littleton Public School webpage, if you try to find information on COVID-19, the latest thing is from last May, I believe. So when we were kind of preparing for our last meeting with the school, I was concerned that it seems like every step you take down from the CDC level, kind of more and more detail gets lost. And I think, thank you, this is highlighting one of those key pieces of information that the closer we get to our community, it seems like some of those details stop showing up in the documents. So correct. I mean, CDC guidance, state guidance say that, but nobody can be expected to follow that guidance if they're not informed about that.
Right.
And I think that's a big problem.
Yeah, and it's an educational piece at this point, I think, on our part to inform people of what their obligations are.
Yeah, I mean, the process is not easy,
No.
but unfortunately, parents have a right to know and children have a right to know. And there need to be knowledgeable, informed decisions being made. And I think this is a red flag for me that we can't just stick our head in the sand and figure it's fine. We've got to have our eyes open to it so that people can make those decisions.
The right decision.
Jim, do you have any comments on this matter?
So, and again, I'd be curious to note what kind of communication did go home for students who tested positive, because that guidance that you're talking about, Matt, is tied to the memorandum from both DESE and Department of Public Health. So that's the guidance that you're talking about is kind of nested within that document what schools should be doing. So I would have assumed they would have at least sent home to the person who tested positive the information for the isolation and quarantine. So that they would have known to do that. How you handle the greater, the other potential exposed in the classroom, I'm not sure how they're handling that.
So, Margot, did you get a letter or a call from the school nurse about how to handle things or what was expected of your student?
I mean, when we emailed the school nurse to say that she had tested positive, that was on a Sunday, and I said, consistent with, I think I cited DPH and probably CDC guidance. I said, we'll be keeping her home, need to get all like the paperwork and whatnot around that and any stuff she'll be missing. And I said, we're going to be continuing to test her. And I think she responded and said, great, she can, as long as her symptoms are improving, she can come back on day 6. So this was Sunday, she tested positive, so she could have gone back on Thursday because her symptoms started showing up late Friday. she could go back on Thursday as long as her symptoms were improving, as long as she were to wear a tight fitting mask, or no, I think just a mask until day 10. And my husband and I looked at each other and we were like, that's nuts. I mean, I didn't want to say it feels like we're sending our child into school with a loaded gun, because that isn't just a metaphor anymore. But I was like, that, so we'd be exposing other kids. And the nurse said, well, she has to wear a mask except for in the cafeteria and at snack time. And I was like, that's what she's already doing. So we kept her home until Monday. But yes, we were told that she could return in a mask following day 6, even if she was still testing positive, which she was. And given that, like, the current dominant variant, the current dominant Omicron variants are showing up in some kids asymptomatically and some adults even asymptomatically. This is where masking helps. When people have been exposed, I'm preaching to the choir here, but yeah, so we did receive that guidance. As far as any guidance that the general school population has received, or it hasn't differed from just the people in the classroom, what they've received, other than like the other parents that heard directly from me.
Got it.
I think part of the challenge for school systems, I mean, you're hearing all the conversations about how much school kids missed and trying to keep kids in school and things. So I think DESE and DPH are trying to balance those two things. Certainly, if you read the language of that joint memorandum from DPH and DESE, that comes through clear on that. And then they tie it to, there's a separate set of guidances for K through 12 and childcare and camps, during the summer on how to handle children either who are exposed or testing positive. So I think it's a matter of them navigating that process and whether, and again, I'm not sure what's happened. So maybe this already has happened from the Littleton public school system. If they've educated all of the parents saying, hey, these are the guidances for the upcoming school year, please review those so that we can keep the school population safe, kind of thing. I mean, that may be the first way to kind of get everyone familiar with what the guidance are for the schools.
Maybe what I'll do is I'll go digging around some of the DPH releases or for DESE releases to see if there's any artwork that we can maybe put a flyer together for the schools to send home to say, hey, if you test positive, this is what you need to do. Like if there is anything on that. I don't know if there is. I can go I'll peruse and see if there's something, Kevin.
Thank you.
Yep.
After the meeting, I can kind of scan and send these 3 documents that I've been referencing to everybody, just so you have them kind of quick. So Matt, sounds like you're looking at them anyway. So yeah,
they've been sent, but yeah, it's the Mass site. That joint memorandum. My problem with that is that the joint memorandum is rather brief and includes links.
Yes.
But if you open it on your computer, it's some Google Doc or something, links don't work. So it says, oh, just follow whatever DPH says. Here's the link. But then you can't get to that DPH information unless you know where to go. So I believe I sent out DPH, CDC, and that memorandum previously. But
okay.
Yeah.
Okay.
So Matt, maybe this week you and I will work on crafting a letter to the school committee, calling out just some of the points we've spoken about this evening. And
Okay.
We'll get it on their agenda for their next meeting to discuss. And hopefully we'll have a resolution, have a plan in place to A, capture that weekly attendance data, B, put in place some sort of exposure notification for potential close contacts, at least within the same classroom of folks that test positive. And
I mean,
and then, if we can, and Kev, if we can put together an educational flyer to sort of distribute, we can get those printed and get them.
So I also know in the devices aren't something that kids have until like middle school-ish time frame. We can also remind the parents that if they do provide their child with a smartphone device that's either an Android or an iOS device, that there is exposure notification on there and it does work. That would also be a benefit to, if somebody does, if the parents do share that, hey, look, you got exposed, it does work. So it is something that can help as a tool. So
Great.
And the last piece that I think we need to bring up is the CDC has specific guidance on responding to an outbreak within a school. But this brings us back to, how do we know if there's an outbreak in the school?
Right.
And do they define what an outbreak is? Because one of the school nurses, she called our nurse and said, "Hey, what's an outbreak?" And like,
Right. Unfortunately, no, the CDC does
Okay.
not.
we didn't think so because we didn't find anything in DPH too. So we're kind of like,
But it doesn't, in my mind, that's not an excuse not to do anything. It means you then just have to come up with your own criteria for an outbreak,
Right.
and then your own criteria for how you're going to watch for it, and then what are you going to do about it? And I honestly don't even care if that is, we're going to call each other and decide it might be bad, and we're just going to call the Board of Health and say, what should we do? I would love it if that was the policy and procedure they wanted, whatever. I just want something.
and so I can say from our experience, when the school nurses do have a question, they do reach out and they talk to our public health nurse, Tamara, and they kind of work it out. So.
Great. Well, thank you, Ms. Bloomstein.
Thank you very much.
I hope everybody feels better.
Slowly but surely. We've got all the fans running.
Thank you for coming.
So at this point, we'll move on. We have, let's see. So we had some administrative matters on here. The minutes, I think that's a typo. We had approved those minutes at our last meeting, and I know Kevin, you'd shared a bunch of data with Brenda, and she is doing her best to get all those minutes together. I know she's got some personal stuff going on with family members, and so hopefully tomorrow she'll be back and we can really just start to crank out the rest of those minutes. Really the only correspondence we had was from Ms. Bloomstein. I did forward all of you that email, and in the future what I'll do is, even if I get it and I see it's got Brenda on there, I'll just make sure it goes out to everybody right away. So do we have any board member updates, comments, any discussion points? We have no more public in attendance, so we'll just do a round robin really quick. We'll go in reverse alphabetical order. Matt Wason.
Only that check your email. Kevin sent those links I was telling you about on August 24th. It says background information for school board meeting. So search for that. You'll get the links. I'm going to ping it to Jim just to make sure we're not missing any components.
Okay.
But that's what I got.
All right. Let's see. We have Dan Kane.
Yes, I actually had a piece of correspondence. I shared it with Brenda and Kevin on Sunday from one of the teachers at high school who is working with a number of students regarding the single-use plastic bag ban warrant article. I believe it's going to be on town meetings warrant coming up. It was modeled, their draft proposed warrant article and bylaw is drafted on similar regulations from other communities, and they use the Board of Health as the enforcement agency for the single-use ban. I believe under the context of waste and trash and environmental impact, which really, as opposed to all the enforcement agencies in the community, Board of Health is, again, we also are responsible for trash and rubbish and refuse and all those pieces. So I believe that was the rationale from other communities, including it under Board of Health as the enforcement agency. The students who put this together, again, use kind of that model language from others. So the draft was shared with me. I shared it with Kevin and Brenda, so I can share it with everybody, but they just wanted us to be aware, and they were open to any thoughts, feedback, or anything that the board or board members may be interested in sharing back with them. So I will reshare it for everybody as long as it's okay with the chair for me simply to share that with.
I forwarded it around, Dan, just now because
awesome.
I didn't know Brenda didn't. I have a question. Do you recall why this failed at town meeting the first time?
I don't remember it being on the head. I don't remember when it was on last time.
It was like maybe 5 years ago.
I do not recall why it went down, other than again, it is from an environmental perspective, kind of makes sense. From a convenience perspective, I admit I do my best and I don't take bags when I don't need to, but I also admit I'm terrible about bringing my reusable bags into the store. I'm bad at it. So from a convenience perspective, I'm guessing I am not the only person who's not always great or thoughtful about grabbing my bag, getting out of the car. So I certainly can't speak for the will of the community, but I can certainly see the challenges associated with not having them available.
So would they like some comments on this and possibly a letter of support? What would be what do they need?
I believe they just wanted us to be aware.
Okay.
So let's say I'm the advisor, provide some guidance on a student-led effort to limit retail issued single-use plastic bags. The students met with the sustainability committee last night, received their support for this article. However, they pointed out that the enforcement language as it stands names the Board of Health as responsible. I believe they wrote this based on other towns' similar articles, but wanted to be sure that it's appropriate. I've attached students' proposed article. We appreciate your help. So it's not necessarily a clear request for support in favor, a non-binding resolution, or simply just feedback of is this even doable at this point? Our enforcement ability is limited because gym staff is limited. Like lots of things when things come in house. Again, I think enforcement is going to be relatively easy. You're going, do you have them or don't you? When you walk into a store doing their 6-month inspections, you do. You shouldn't. Please stop.
Mm.
But I think that's one of those things that's as opposed to cleanliness of rooms and those kind of pieces where it's an ongoing discussion or educational piece from the enforcement agents. In this case, they have them or they don't, and once they don't, I wouldn't expect them to suddenly start when it's against town regulations. But
yeah, this is great. Kids are getting a good experience doing this, and if we need to respond to them, since you're the point on this, just let us know what we can do to help them. But yeah, Board of Health would be the enforcement folks, and I think it's easier than some of the other enforcement tasks, just because you can see. All right, we have Gino Fratelloni. Any member comments, updates?
No, at the moment, no.
Okay. Kevin Davis.
Go get your vaccinations. Go get your COVID-19 booster vaccination. The 5-year-old to 12-year-old. It's rumored that the EUA is going to be coming out soon for people to kind of go off and vote on at the FDA and the CDC. So that's good news for our younglings. Go get your flu vaccination. Australia had a not so fun time their past winter, our summer, spring. So that's where it comes from. Yay, birds. So time to start to think about doing that. And yes, you can get both at the same time as I did. And it just means, one on each shoulder. It was fun. It just means that you're either sleeping on your stomach or on your back, because for me, a little arm soreness and a little bit of ibuprofen solved that problem. But yeah, so yay. That's it.
And I just wanted to make a note of the blood drive that the town will be having on October 6th. We will get more details on that, get them up on the website, and hopefully we can get it out on Facebook through Elder Human Services. Jim, did you have any final comments, words of wisdom? You're muted.
I don't, but Matt, I saw your email, and 2 of the 3 documents are there. I'll send them one last document then. There's not much in it. It's just, I think, an excerpt from the school health manual. So
is that school health manual on the DESE page, or is that something behind a paywall that you have to get access to?
no, it's a Department of Public Health document. So if you kind of
I'll go Google.
Yeah, it's a big, huge document. And what's nice about it, it covers all aspects of school health for the school health office. So COVID hasn't made it in there as one of the diseases yet, but I'm sure once they kind of figure things out, it'll be a page in the book too.
One last piece for those viewers who just skipped to the fun part at the end of the meeting. I just want to repeat Kevin Davis's recommendation that if you do an at-home test, please look at that at-home test, see if there's an app associated with it, and please voluntarily report your result to the CDC, because the more data we have, the better equipped we are to handle the future. Thank you very much.
All of them have apps. All of them. Every last freaking one of them.
That's just a pain, because you know how many different brands of tests I have now? It's just...
I've got 4.
So all that's left is a motion to adjourn.
Make a motion to adjourn.
Second.
All right, we have motion to adjourn and a second roll call vote. Kevin Davis,
Kevin Davis, yes.
Gino Fratelloni,
For only yes, thank you for coming.
Dan Kane,
Dan Kane, yes. Thanks, everybody.
Matt Wason,
Matt Wason, yes.
and Kevin Baker votes yes. Thank you guys. Thank you, Jim. Thank you, Dave. And we'll see you in a couple weeks, but we'll all be offline. We'll pass some emails around and get some work done. Thank you, guys.
Thank you.